The moment you receive your blood test with an elevated cholesterol level, you might immediately feel like you're at risk of atherosclerosis or cardiovascular diseases, like heart attack or stroke. You might assume that a cholesterol-free or very low cholesterol diet is essential to bring your cholesterol back down to normal. However, a cholesterol-free diet is not a wise option, and a very low cholesterol diet is not an effective strategy for managing blood cholesterol in most people with elevated levels. In this video series, we present 3 reasons why a cholesterol-free diet is generally unnecessary for preventing atherosclerosis and may actually be detrimental to your health. Before we begin, remember to hit the subscribe button and give us a thumbs up if you're ready to explore with us. Alright, let's get started. First, the cholesterol in your food does not directly convert to the cholesterol in your blood. Many people believe that eating high cholesterol foods, such as eggs, shrimp, and full-fat yogurt, directly raises their blood cholesterol levels, but the reality is more complex. To understand the relationship between the cholesterol in your food and the cholesterol in your blood, it's necessary to know how the human body produces cholesterol. Cholesterol is a waxy, fat-like substance found in every cell of our body. The primary building block for cholesterol synthesis is acetyl coenzyme A, a molecule derived from the breakdown of carbohydrates, fats, and proteins. This synthesis is initiated with acetyl coenzyme A and supported by 2 essential components: NADPH, nicotinamide adenine dinucleotide phosphate, and ATP, adenosine triphosphate. NADPH is a coenzyme that provides the reducing power needed for the biosynthesis of cholesterol. ATP supplies the energy required for the various reactions in the cholesterol synthesis pathway. This intricate process illustrates that the cholesterol you consume in food does not directly correspond to the cholesterol level in your blood. Instead, your body's internal production and regulation play a significant role in maintaining cholesterol levels. The human body is a sophisticated system that produces most of the cholesterol found in your blood. Cholesterol levels in peripheral tissues are regulated by a balance of uptake and export. While most cells can synthesize cholesterol, the majority is either ingested or synthesized by hepatocytes and transported in the blood to peripheral cells. The liver produces about 75% of the body's cholesterol. Additionally, under normal conditions, brain cholesterol remains separate from peripheral cholesterol because dietary and hepatic cholesterol do not cross the blood-brain barrier. Instead, astrocytes, a type of glial cell that constitutes the majority of cells in the central nervous system, produce and distribute cholesterol within the brain. This means that only a small portion of your blood cholesterol comes from the food you eat. Moreover, when dietary cholesterol intake increases, the liver typically compensates by producing less cholesterol to maintain balance. Cholesterol in food is often accompanied by other dietary fats, such as saturated fats and trans fats, which are ingested simultaneously. Understanding the distinction between cholesterol and other dietary fats can clarify why a cholesterol-free diet is unnecessary. Saturated fats and trans fats, found in foods like red meat, full-fat dairy products, and processed snacks, have a much greater impact on raising blood cholesterol levels than dietary cholesterol itself. These fats affect your blood cholesterol levels in 2 ways. First, saturated and trans fats can prompt your liver to produce more cholesterol, leading to an increase in blood cholesterol levels. Second, liver cells have LDL, low-density lipoprotein, receptors. When LDL cholesterol circulates in the blood, these receptors capture and remove the cholesterol, transporting it into the liver for breakdown. Research suggests that excessive consumption of saturated fat can impair the function of these receptors, causing cholesterol to build up in the blood. Another important aspect of dietary cholesterol is that people respond differently to it due to genetic factors. Some individuals, known as hyperresponders, may experience a more significant increase in blood cholesterol levels when they consume cholesterol-rich foods. However, even in these cases, the increase in LDL cholesterol is often balanced by an increase in HDL, high-density lipoprotein, cholesterol, which can help mitigate cardiovascular risk. Approximately 1 in 250 individuals has a genetic mutation for the LDL cholesterol receptor that leads to familial hypercholesterolemia, FH. This condition affects about 1.3 million people in the US, including children, but only about 10% are aware they have it. The good news is that familial hypercholesterolemia is treatable with medications and lifestyle changes. In summary, the cholesterol in your diet is not directly converted to cholesterol in your blood. The liver's regulation, the impact of other dietary fats, individual genetic factors, and the essential role of cholesterol all contribute to this complex relationship. The biggest influence on blood cholesterol levels is the mix of fats and carbohydrates in your diet, not the amount of dietary cholesterol you consume. Instead of focusing on eliminating dietary cholesterol, aim for a balanced diet that supports overall heart health. As we mentioned at the beginning of this video, atherosclerosis in your arteries is a key concern. Our discussion on the necessity of a cholesterol-free diet is aimed at preventing cardiovascular diseases caused by atherosclerosis. Welcome back to our video series where we dive deeper into atherosclerosis, cholesterol, and the key factors driving cardiovascular diseases. In our previous video, we discussed why a cholesterol-free diet is generally unnecessary for preventing atherosclerosis. Today, we'll look at the second reason, identifying the true primary cause of atherosclerosis in your arteries. We're here to challenge a common misconception that cholesterol is the main culprit behind atherosclerosis and cardiovascular disease. Despite its negative reputation, the reality is much more complex. Join us as we explore why cholesterol isn't the primary cause of these conditions. We'll also discuss 3 key factors that actually influence the development of atherosclerosis and are crucial for maintaining heart health. Number 1. Inflammation. One of the key factors in the development of atherosclerosis is inflammation, not cholesterol itself. When the arterial walls are damaged by factors such as high blood pressure, diabetes and reduced insulin resistance, or smoking, the body responds with an inflammatory process. This inflammation leads to the formation of plaques, which are composed of cholesterol, fatty substances, cellular waste products, calcium, and fibrin. The presence of cholesterol in these plaques is a consequence of the body's attempt to repair arterial damage, not the cause of the damage. Research has also shown that chronic high blood sugar levels in diabetes can cause direct damage to the endothelium, similar to the effects of high blood pressure and smoking. Additionally, diabetes is associated with increased levels of inflammatory markers, which exacerbate the inflammatory response in the arteries. This makes individuals with diabetes more susceptible to the development and progression of atherosclerosis. Insulin resistance also impacts lipid metabolism, often leading to higher levels of LDL cholesterol and lower levels of HDL cholesterol. This imbalance further contributes to plaque formation and increases the risk of cardiovascular events. Controlling inflammation and insulin resistance is crucial to preventing and treating atherosclerosis. This can be achieved by controlling risk factors such as high blood pressure, diabetes, and insulin resistance, as well as making lifestyle changes like maintaining a healthy diet, exercising regularly, and quitting smoking. By understanding and addressing inflammation, you can better manage your cardiovascular health and reduce your risk of serious complications. Number 2. Type of LDL particles. Not all LDL particles are the same. The size and density of LDL particles can also significantly affect the development of atherosclerosis. Small, dense LDL particles, LDLB, are more likely to penetrate damaged arterial walls and contribute to plaque formation, while larger, less dense LDL particles, LDLA, are less harmful. There are at least 2 theories as to why small, dense LDL particles are more dangerous than larger, less dense particles. First, small, dense LDL particles can more easily squeeze through the tiny gaps between the cells in the endothelium, the thin layer of cells lining the inner wall of the arteries, reaching the inside of the artery walls. Second, small, dense LDL cholesterol particles are more susceptible to oxidation, and the oxidation of cholesterol contributes to the formation of cholesterol plaques. Due to these characteristics, small, Dense LDL cholesterol particles are associated with accelerated atherosclerosis and a threefold increase in the risk of coronary heart disease. This type of particle is considered a major cause of atherosclerosis in people with normal or near-normal total and LDL cholesterol levels. In addition, people with predominantly small, dense LDL cholesterol particles often have low HDL cholesterol levels, elevated triglyceride levels, and a higher risk of developing high blood sugar and type 2 diabetes. The focus should be on reducing the number of small, dense LDL particles rather than simply lowering total LDL cholesterol levels. While the size of LDL cholesterol particles is primarily determined by genetics, diets low in saturated fat, regular aerobic exercise, and weight loss have been shown to reduce the number of small, dense LDL particles and increase the number of large, less dense LDL particles in the blood. If lifestyle changes are insufficient, medications can be used. Although statin medications are effective in lowering overall LDL cholesterol levels, they have a limited effect on the size and density of LDL particles. Medications like nicotinic acid and gemfibrozil have been found to be effective in increasing the size and density of LDL particles in many cases. Number 3. Genetic mutations. Apart from the aforementioned two factors, specific genetic mutations lead to atherosclerosis as well. Changes in the LDLR gene are the most common. The LDLR gene provides instructions for making a protein called an LDL receptor. This type of receptor binds to LDLs, low-density lipoproteins, which are the primary carriers of cholesterol in the blood. By removing LDLs from the bloodstream, these receptors play a critical role in regulating cholesterol levels. Some mutations in the LDLR gene reduce the number of low-density lipoprotein receptors produced within cells. Less common mutations, such as those in the ApoB, apolipoprotein B, LDL-RAP1, or PCSK9 genes, lead to the production of abnormally functioning LDL receptors. Consequently, mutations in any of these genes disrupt the receptor's ability to remove low-density lipoproteins from the bloodstream. As a result, individuals with these specific genetic mutations have very high levels of blood cholesterol. The excess cholesterol circulates through the bloodstream and is deposited abnormally, contributing to the development of atherosclerosis in the arteries. This can lead to cardiovascular diseases such as heart attack and stroke. These genetic mutations affect approximately 1.3 million people in the US, but only about 10% are aware that they have them. Researchers are working to identify and characterize additional genes that may affect cholesterol levels and heart disease risk. Some of these conditions can be treated with lifestyle changes. Alright, these are 3 factors that can influence the process of atherosclerosis. As we mentioned here and in the previous video about the causes of cardiovascular diseases due to atherosclerosis, the primary cause of atherosclerosis is neither your dietary cholesterol nor your blood cholesterol. To dispel the common misconception about cholesterol, the next video will explain why cholesterol is essential to life. It plays a critical role in thousands of bodily functions. Want to know why and how? Stay tuned. In our last few videos, we debunked the most common misconception about cholesterol. Now we're going to explain why cholesterol is essential to your life. Join us as we explore how cholesterol plays a critical role in your body and why maintaining a balanced diet is crucial to preventing cardiovascular diseases caused by atherosclerosis. If you are interested in previous videos on this topic, you can subscribe to this channel and watch them later. Cholesterol often gets a bad reputation due to its association with cardiovascular disease and atherosclerosis. Many people think of cholesterol as something that only harms their health. However, it's important to recognize the many positive roles cholesterol plays in the body. Cholesterol is critical to many body functions that are essential to maintaining health and well-being. Let's take a closer look at why cholesterol is so valuable to our bodies and explore 7 critical functions of cholesterol. Number 1. Structural component of cell membranes. Cholesterol is a fundamental building block of cell membranes. With over 30 trillion cells in your body, each cell has a membrane that serves as a barrier, controlling the movement of materials into and out of the cell while separating its interior from the external environment. Cholesterol is embedded within the lipid bilayer of cell membranes, where it plays a key role in maintaining their fluidity and stability. Making up more than 30% of the membrane, cholesterol is critical to the structure, elasticity, and functionality of cell membranes. It helps protect cells from damage and facilitates effective communication and transport of substances in and out of cells. Without cholesterol, your cell membranes and cells would not function properly, leading to dysfunction in your organs and a range of potential diseases, some of which could be life-threatening. Now, do you see how important cholesterol is to you? Absolutely yes. And this is just the beginning. Number 2, synthesis of hormones. Steroid hormones regulate inflammation, sexual development, immune functions, metabolism, salt and water balance, and the body's ability to withstand injury and illness. Cholesterol is a vital precursor for producing steroid hormones, such as cortisol, aldosterone, and sex hormones like estrogen, progesterone, and testosterone. These hormones are crucial for regulating various physiological processes in the body. Low levels of cortisol or aldosterone can cause persistent fatigue, muscle weakness, unintentional weight loss, muscle and joint pain, low blood pressure, dizziness, and fainting. Additionally, since cortisol impacts mood, low levels can result in mood swings, irritability, and even depression. Low levels of estrogen and progesterone often lead to an increased risk of osteoporosis due to decreased bone density. Women may also face menstrual irregularities and challenges with maintaining pregnancy due to an unstable uterine lining. In men, low testosterone levels can lead to decreased libido, erectile dysfunction, lack of energy, decreased muscle mass, mood changes, and hair loss. Therefore, cholesterol is such an important substance that only with it can the body modulate and regulate the thousands of chemical reactions involved in producing and managing these essential hormones. The third function of cholesterol is the production of vitamin D. If you frequently experience muscle spasms, muscle pain, or even bone pain, it's important to check your vitamin D levels. A deficiency in cholesterol could be the underlying cause. Cholesterol is an indispensable precursor for the synthesis of vitamin D. This process begins in the skin, where a form of cholesterol known as 7-dehydrocholesterol is present and responds to sunlight. Vitamin D is necessary for maintaining healthy bones and teeth, supporting the immune system, and regulating calcium and phosphorus levels in the blood. The synthesis of vitamin D from cholesterol highlights the need for adequate cholesterol levels to support essential physiological processes. This is crucial for producing sufficient vitamin D and maintaining overall health. The fourth important function of cholesterol is formation of bile acids. Bile acids are crucial for digesting and absorbing dietary fats and fat-soluble vitamins, like vitamin A, D, E, and K. They emulsify fats, breaking them down into smaller particles that digestive enzymes can more easily process, aiding their absorption into the bloodstream. Cholesterol is converted into bile acids in the liver, which are then stored in the gallbladder and released into the small intestine. Without enough bile acids, you may experience steatorrhea and diarrhea because excess fats are not properly emulsified and absorbed. Insufficient bile acids can also lead to the formation of cholesterol gallstones, as bile acids are needed to keep cholesterol dissolved in the bile. Number 5. Insulation of nerve fibers. Cholesterol is essential for the development and protection of nerve cells, which enable the brain to communicate with the rest of the body. Cholesterol is an integral part of myelin, the protective sheath that surrounds the axons of nerve cells. Myelin acts as an insulator, enabling rapid and efficient transmission of electrical impulses along nerve fibers. This insulation is required for the proper functioning of the nervous system, including motor coordination, sensory perception, and cognitive processes. Damage or dysfunction of myelin due to insufficient cholesterol can lead to various neurological problems, including multiple sclerosis, MS, peripheral neuropathy, optic neuritis, and changes in cognitive and behavioral functions. Number 6. Regulation of cell signaling. Cholesterol also plays a crucial role in cell signaling processes by assisting in the formation of lipid rafts within the plasma membrane. These lipid rafts are specialized microdomains that act as organizing centers for the assembly of signaling molecules, thereby facilitating communication between cells and the transmission of signals that regulate various cellular activities. By contributing to the formation and stability of lipid rafts, cholesterol ensures proper regulation of signaling pathways, which is essential for processes such as immune response, cell growth, and differentiation. Number 7. Antioxidant properties. Less well known, but incredibly important, is cholesterol's antioxidant properties. As an antioxidant, cholesterol helps protect cells from damage caused by free radicals, which are unstable molecules that can damage cellular components such as DNA, proteins, and lipids. Free radicals are produced naturally in the body during metabolic processes and can be increased by external factors such as pollution, radiation, smoking, and poor diet. The accumulation of free radicals leads to oxidative stress, a condition associated with various diseases, including cancer, cardiovascular disease, and neurodegenerative disorders. By integrating into the lipid bilayer of cell membranes, cholesterol helps maintain membrane integrity and fluidity. This structural role also helps protect cells from oxidative damage by acting as a physical barrier to free radicals. Okay, those were 7 major functions of cholesterol. This was the third part of the series Current Advances in the Causes of Cardiovascular Diseases. In the 2 previous parts, we also discussed some misconceptions about cholesterol. If you are interested in this topic, you can watch those videos on this channel. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.